here today we're talking about loneliness, as Upasana said. Every kid today, every teenager today, every adult as well is feeling loneliness, being confined into their houses as well. What do you do then? You either make your Zoom calls, you either watch your Netflix, you either start, playing on your social media, you start doom scrolling as well. Now, at some point, there has to be a healthy balance in terms of when to stop.
So basically, as we discussed, I think communications remains the milestone if we have to even work on technology use. And communication can also happen through engagement with children with various leisure activities, because that we are missing. I think leisure activities has become now digital leisure activities, whether it is for children, whether it's adolescent or parents also. Everybody has changed the definition of leisure. It has become digital. So we have to be conscious whether we can again bring a balance of offline leisure activities with some online leisure activities. Second thing, all of us have to practice digital hygiene also. Digital hygiene, when I say, the parent should become a good role model.
You start detoxing as a parent, your child will follow. You start and start reading a book, your child will follow. Absolutely, they'll follow. There's no way they'll not follow.
But there are so many out there in the country who still think it's a taboo. Psychiatrist के पास क्यों जाना है? आप पागल थोड़ी हो गए हो? That is still the norm in this country, in a large part of the country.
It still is. And one of the things here that we always discuss is mental health budget. Our government, our policies, they'll only need to probably propagate the way the other healthcare industry is being propagated, that prevention is better than cure.
Yeah.
So similarly, you don't have to have a full-blown mental disorder to reach to a therapist or a psychiatrist. So let's say psychiatrist, yes, medications, full-blown mental health illness. But a mental health professional wherein you'll be talking, a counselor where there's only going to be talk therapy, it's prevention. It's you're noticing something's not right. It's noticing that you don't feel like working. It's noticing that your child doesn't want to study. It's noticing that he's not able to do the things he was able to do earlier. Right? So when you notice that, when you see those telltale signs, it's important that we kind of prevent it. So the more it keeps coming in the mainstream media and the more people start looking at it as a normal aspect of life, it's like, again, I will say, you go to a salon for fixing your hair and everything, right? Similarly, you go to a counselor for fixing your thoughts, not even fixing your thoughts, but just getting them more coherent.
Dr. Manoj, what are the steps that parents can take first for de-addiction and set an example for their children as well?
I think first parents also have to acknowledge that they have excessive use of technology. So once the acknowledgement comes, it will lead to action which they can bring in terms of lifestyle changes, they can bring in terms of controlling their technology use whenever they are in the home setting or whenever they are with the young children or with the adolescent.
An addiction is an addiction, whether it is to drugs, whether it is to alcohol, or whether it is to social media. That dependency is something that people are struggling to let go of.
Three things they should keep in mind. First is preoccupation or the continuous desire to either remain engaged with technology or with substance use. If that is happening, that will also have a significant impact on his or her lifestyle. Second thing they have to realize is, do they have control or are they losing their control for technology or for substance use? If that is happening, if the loss of control is there, it will take away a lot of their time from the productive hours and they will spend either in technology or in substance use. Third would be continuous indulgence in technology use or substance use despite knowing the consequences. They know their physical health is suffering, they know their academics are suffering, they know that family relationships are taking a backseat, but still they are persisting with the use. So if these three things are coming up in their lifestyle, that's a red signal to seek help